first treatment is trying to interrupt or reverse the stroke. One treatment is giving a medication to dissolve the clot. This can be done within 4.5 hours of the patient last being seen well. Another treatment is to try to remove the clot in a large vessel. This can be done up to 24 hours after the patient has been last seen well. Both of these treatments have risk and can produce bleeding. For that reason, they are not used outside these time frames, and they are not used in patients who have a relatively mild or non-debilitating stroke. The second part of our treatment in hospital is trying to adjust treatment to prevent strokes in the future after hospitalization. One part of that is adjustment of blood thinners. Another is addition of medication to lower cholesterol. We will often adjust the blood pressure medication, but that is often later at the end of the first week or in the second week. We'll, of course, counsel for smoking cessation. We will look into whether there are any heart abnormalities that may change our suggestions for treatment. We'll also assess the carotid artery in the neck to see if surgical treatment for stroke prevention would be appropriate. The other part of our evaluation in hospital is evaluation of the patient's need for rehabilitation. Patients will be assessed by specialists in physical therapy, occupational therapy, and speech therapy. These specialists will help devise an outpatient rehabilitation program. Some patients, those who are relatively immobile or at risk for falls, will need to go to inpatient rehabilitation centers for several weeks to regain enough function that they can be safe at home. Other patients with lesser degrees of problems will be able to go straight home after their stroke, working with VNA and physical therapy at home or working with outpatient physical therapy. The problems after a stroke will never be quite as severe as right at the time of the stroke. Patients can generate a significant recovery if they work with their physical therapy and maintain their medications.